Hi, welcome to a webinar. This is titled, If You Have Shoulder Pain, What is the One Thing You Need to Know and Why Your Doctor May Not Have Told You About It. My name is Dr. Jeff Donatello. I'm the clinic director at the Center for Wellbeing here in Portsmouth, New Hampshire, and I am certified in functional medicine. I'm a clinical nutritionist. I have over 25 years of working with patients with chiropractic medicine, and more importantly, we've had over 2,000 patients come in our office to use regenerative therapies. So let's get really right into this because I know it's important. There's lots of webinars. There's a lot of confusing information when it comes to having shoulder pain. But our goal is to give you valuable information that you may have been searching for all in one place, and it's in the next 10 minutes in this webinar. And if you do have questions for your chronic shoulder pain, you can call me and we can do a free 15-minute phone consultation. At the end, we'll give you information on how to do that, okay? So if you're struggling with shoulder pain, what I find with our patients is that many of them, they can't do top shelf activities. They can't reach up anymore, which is really a problem. If you're cooking, especially if you're active in sports, skiing, it's not fun, right? It's not at all. Sleeping is an issue for people with chronic shoulder pain. And pain creates a bad attitude. It makes you really not want to be around people sometimes, and sometimes they don't want to be around you. So it's a frustrating thing. So it's my passion to keep people from having surgery and getting them back into life, okay? So that one thing, let's get to the root cause of it. That one thing you may not know about is regenerative therapies. And what are they? Because it can be really confusing. Well, the definition of regeneration is to grow, repair, create, build new tissue. So in a little bit, we're going to talk about the 3 therapies. And these are the answers that you've been looking for. This is now available all across the country, all across the world. It's been available for over 20 years. People used to fly on their jet airplanes all over the world. The rich people of our country would go get care everywhere else. But now it's here and it works, okay? So regenerative therapies. We're going to talk about stem cell derived biologics. We're going to talk about PRP and prolozone. Those are the 3 biggies, all right? So, but the big question is this: why has your doctor not told you about it? And it can be, we're not going to harp on this, but it can be frustrating, right? Your doctor, if you see this guy here, this doctor here, on his right shoulder, he's influenced by insurance companies and big pharma, okay? So the big pharma, they basically say, you're going to use our medications, we're going to teach you how to use them, and the hospital says, here's how we're going to get paid. And the insurance covers what they do, which is great. Unfortunately, insurance does not cover what we do, but we have ways of paying for it. The average person can afford something in our office, but that's our system right now. So while your doctor does want to get you better, and there is a place, don't get me wrong, for drugs and surgery, it's not real good if you have chronic issues. So what happens is the people that come in our office have been suffering for 6 to 12 months or for 6 to 12 years, some of them, with pain that just isn't going away. And these regenerative biologics can help that get better. So if you go to your doctor and they just inject cortisone, or we'll talk a little bit about that in a second, it's almost like just putting duct tape on it, right? Or if they give you a drug, here, just take this drug. Let's hope it goes away. Pop, pray, hope it goes away. They're not doing anything to actually fix the bumper in this case, right? So here's what happens. If you have surgery, if they've told you need surgery, it may be the best route. If you have a labrum, the smooth lining of that ball and socket joint in your shoulder, if that labrum is teared with what's called a slap tear, that means the superior part of the labrum is torn from the front to back. That may be a surgical candidate. You may have a torn rotator cuff, though, that's only stage 1 or 2. It's not stage 3. Those are the people we see where they're just not getting better, all right? So know that there's certain things that you might need surgery for. There's certain things you probably don't want surgery for. The biggest thing you don't want surgery for, trust me, this one is if you have a degenerative shoulder and they go in and they want to scrape your shoulder out and clean it up. It might seem like it makes sense, right? But if we look at studies from what they've done to the knee, and there's a big one from the American Academy of Orthopedic Surgeons did this large study where they looked at it's over 1,600 people that had scope surgery on their knee. The vast majority of those people had to go on and have knee replacement. And I think it's kind of the same thing. If you're going in and think you're going to clean up a arthritic shoulder that is full of arthritis, it doesn't work that way. That's why we use regenerative biologics. The other thing is this: the cost of shoulder surgery can be anywhere from $4,000 to $50,000 depending on what it is you do. And you're taken out of the game for some time. You've seen people walking around with that big brace they have on. They can't do anything for sometimes months on end. That's a problem, right? And that's what's great about what we do. We get you back into life very quickly. So if you look at this funnel here, the way that you go to your doctor, they want to inject cortisone quite frequently into it, right? Which is maybe okay if you did it once and it worked. But the real problem is the more you do cortisone, the more you're going to have arthroscopic surgery or surgery in general in their eyes, okay? So we don't want to do that. We want to minimize the corticosteroids that are going into you for sure. All right, keep that in mind, all right? The other risk that goes with surgery is anesthesia. When you have surgery and you are put under, there is an increased risk from your brain not really recovering as well, and you have an increase of dementia and Alzheimer's disease. So, and that was a study from the Mayo Clinic that was done in 2018. Look it up. There's over 2,000 people that were in that study. So you don't want to go under if you don't have to. Okay, so that's what we love. We try to keep people from going under and having corticosteroids, and just in general, steroids and drugs. We try to keep people away from having those things put in them. Okay, so let's talk about regeneration: to grow, build, create, repair new tissue. The 3 therapies we do in our office are stem cell derived biologics, stem cell exosomes, PRP, and prolozone. And this might be French to you, right? Or Russian, or some language that you don't know. So let's break it down and really get into what we're talking about. So prolozone is using ozone. It's a gas directly injected into the joint. It's done in a very safe way. And when you get that shot, what it does is it's a highly anti-inflammatory way of getting everything to calm down in the joint. Sometimes it takes 1 injection, sometimes it can take 3, 4, 5, but prolozone is a relatively inexpensive way to get help. And we combine prolozone with stem cell exosomes and PRP, and we'll talk about that in a little bit, okay? So PRP, platelet-rich plasma, it's been around for 25 years, maybe more. This is taking your own blood, we draw it, and we put it in a centrifuge, we spin it up, and we take out the growth factors and the platelets and inject them back in. This is a great therapy if you're under 40 years of age, because what PRP does, your own growth factors, your own platelets, stimulate your own stem cells to secrete exosomes to decrease inflammation and to heal. But if you're over 40, it's very difficult to use PRP successfully. It can be done. If you're 60, 70 years old, I just see that it doesn't work. But PRP is great when mixed with the mesenchymal stem cell biologics that we're going to talk about here. All right. So what do? We use the exosomes, what's secreted from the stem cells. There's no DNA. They're not live. They're just microvesicles. It's taken from a healthy baby, healthy mom, and it's from C-sectioned individuals. And it's done it's all from a lab that is FDA regulated. Everything is above the board. We visited the labs. They're really good, and we've had over 2,000 patients go through these therapies. So the way we do it is we mix PRP with the stem cell exosomes, and it seems to work really well. So what does it do? It reduces inflammation first. It's the most powerful way to reduce inflammation, and it regulates your immune system so that your brain says, hey, let's get this body healing. Let's get out of this pattern of chronicity and pain and start healing again. So there's no potential for adverse reaction or allergic reaction. Blood types don't need to match. It's a really great way to do this. The therapy takes half an hour. We always do a consultation and exam to make sure you're a good candidate. How long does it take to see results? Usually within the first 6 weeks, patients are 50% better. Our success rate is 90% of our patients are 60 to 80% better a year later. That's what we've seen. Out of our 2,000 patients, we've probably had 400 people with chronic shoulder pain. Shoulders and knees do very, very, very well. How long does it last? It's not something you have to have done every year. If you take care of your body afterwards, if you treat it well and you don't re-injure the joint, then you can go on healing for some time, for years and years. We've had patients that have told us 3 years later that they're still healed and they're doing really well. So the cost of prolozone is $175 an injection. PRP is $800, and stem cell exosomes is $4,675. So there's many things we can do for you. Everyone's different. Some of you may be a candidate for prolozone by itself. Others may need to have stem cell exosome therapy. And what we do is we combine many therapies. The stem cell exosomes are combined with PRP, and we do prolozone a week out, and we do prolozone afterwards. So it's a system because we lead New England in doing these therapies, we've really been able to test and see what works and what doesn't. And we find that the therapies, when combined, for many people do really well. So it's a combination put together. The price is $46.75 for everything. Insurance doesn't cover what we do in the vast majority of time. Okay, everyone wants it to be covered. I wish that it was. Why isn't it covered? That's a question we get all the time. Insurance covers drugs and surgeries that have been around a long time, and that's just where we're at right now. It stinks. It's coming. Probably 5 years from now it'll be covered, but right now it's not, and that is unfortunate. So what's next? Well, we had to do a free 15-minute phone consult. All you have to do is give us a call. We're at 603-380-9159. On this page, on the web page, the landing page, you got our information. I think you can probably reschedule yourself, and you'll be able to talk to me directly. I'm Dr. Jeff Donatello. I'm the clinic director here at the Center for Wellbeing in Portsmouth, New Hampshire, and I can answer any questions you have and help you with your journey, because that's what this is. You're trying to get out of pain. You're trying to get back into life. And that's what we do. We get people back into enjoying what they once loved doing. Hope this was informational. The information was excellent for you. You learned a lot, and we will talk in the near future. Thank you much.